NCLEX RN GI questions. Question 1. Set 1. What is the purpose of administering magnesium sulfate to a preeclamptic patient? To lower blood pressure, to prevent seizures, to induce labor, to increase fetal lung maturity. Magnesium sulfate is the drug of choice for seizure prophylaxis in preeclampsia/eclampsia. Question 2. Set 2. A patient with COPD is receiving oxygen. Why should the nurse maintain the flow rate at 1 to 2 L/min? To prevent oxygen toxicity, to avoid suppressing the hypoxic drive, to prevent dry mucous membranes, to save cost. Patients with chronic hypercapnia rely on low oxygen levels to stimulate breathing. Question 3. Set 3. What is the priority intervention for a patient experiencing chest pain? Administer morphine, obtain a 12-lead EKG, check blood pressure, call the family. A 12-lead EKG is the priority to determine the cause of chest pain, ischemia versus me. Question 4. Set 4. A patient is hearing voices that say, "Kill yourself." What should the nurse ask first? How long have you heard these voices? Do you have a plan to carry this out? Why do you think the voices say that? Would you like some medication? Assessing for safety and a specific suicide plan is the priority when a patient reports command hallucinations. Question 5. Set 5. A client has a chest tube. The nurse notes continuous bubbling in the water seal chamber. What does this indicate? Normal function. An air leak. The lung has expanded. The tube is occluded. Continuous bubbling in the water seal chamber indicates a leak in the system. Question 6. Set 6. A nurse is caring for a patient with neutropenia. What should be avoided? Hand washing, fresh flowers and raw fruits, wearing a mask, high-calorie foods. Fresh flowers and raw produce can harbor bacteria and fungi, posing a risk to immunocompromised patients. Question 7. Set 7. A patient with cirrhosis has an elevated ammonia level. Which medication should the nurse expect to administer? Lactulose, furosemide, spironolactone, propranolol. Lactulose promotes the excretion of ammonia through the stool. Question 8. Set 8. What is the golden hour in newborn care? The first hour after birth for skin-to-skin and bonding, the first hour of active labor, the first hour of the second stage, the hour before discharge. The first hour after birth is critical for bonding and initiating breastfeeding. Question 9. Set 9. A patient with type 1 diabetes is shaky and sweaty. What should the nurse do first? Administer insulin, check the blood glucose level, give 15 g of simple carbohydrates, notify the provider. Assessment of blood glucose is the first step when hypoglycemia is suspected. Question 10. Set 10. Which breath sound is commonly heard in a patient with an acute asthma attack? Crackles, wheezing, rhonchi, pleural friction rub. Wheezing is caused by air passing through narrowed airways. Question 11. Set 11. What is the priority when a patient falls? Complete an incident report, notify the physician, assess the patient for injury, move the patient back to bed. Assessment of the patient's condition is always the first priority after a fall. Question 12. Set 12. At what age should a child be able to sit unsupported? For months, 6 months, 9 months, 12 months. Most infants can sit unsupported by 6 to 8 months. Question 13. Set 13. A child is admitted with tetralogy of Fallot. Which position helps during a TET spell? Supine, knee chest position, prone, side lying. Knee chest position increases systemic vascular resistance and improves oxygenation during cyanotic spells. Question 14. Set 14. What is the primary goal of care for a patient with Alzheimer's disease? Curing the disease, maintaining safety and function, improving memory, teaching new skills. Management focuses on safety, nutrition, and maintaining the highest level of function possible. Question 15. Set 15. Which type of immunity is gained after receiving a vaccine? Natural active, artificial active, natural passive, artificial passive. Artificial active immunity results from vaccination. Question 16. Set 16. A nurse is caring for a patient with atrial fibrillation. What is the primary risk for this patient? Heart failure, thromboembolism and stroke, ventricular tachycardia, hypotension. Stasis of blood in the atria can lead to clot formation and subsequent stroke. Question 17. Set 17, which is the correct order of the nursing process? Planning, assessment, diagnosis, implementation, evaluation. Assessment, diagnosis, planning, implementation, evaluation. Diagnosis, assessment, implementation, planning, evaluation. Evaluation, implementation, planning, diagnosis, assessment. aPass assessment, diagnosis, planning, implementation, evaluation. Question 18. Set 18. A patient on chemotherapy has a platelet count of 20,000. What is the nurse's priority? Infection control, bleeding precautions, managing nausea, increasing protein intake. Thrombocytopenia, low platelets, puts the patient at high risk for bleeding. Question 19. Set 19. A patient is scheduled for surgery. When should the consent be signed? In the OR, after the sedative is given, before any preoperative medications are administered, in the recovery room. Consent must be signed while the patient is alert and not under the influence of mind-altering drugs. Question 20. Set 20. Which fetal heart rate pattern is most concerning? Early decelerations, late decelerations, accelerations, moderate variability. Late decelerations indicate uteroplacental insufficiency and are non-reassuring.